In this video, I am going to talk about breastfeeding, its benefits and the usual problems faced by the new moms. First of all, let's look at the benefits for the baby. It reduces the infection rates in the babies and also allergic diseases and asthma and also some sudden infant death syndrome. And it prevents childhood obesity, and some studies have shown that there is a lesser incidence of cardiovascular diseases in the breastfed children when they grow into adulthood. And also some studies have shown that breastfed children have more IQ than non-breastfed children. Now let's come to the mother. What are the benefits the mother is going to have by breastfeeding? Some studies have shown that it helps the mother to lose weight and also it reduces the postpartum depression. Definitely, it reduces the incidence of breast cancer, ovarian cancer and the endometrial cancer. And some researchers have shown that it reduces the incidence of type 2 diabetes mellitus and also it gives cardiovascular protection. So now let's address the problems that are faced by the mothers during breastfeeding. Now let's address the problems faced by the new mothers during breastfeeding. They fall into mainly three categories: inadequate feeding, nipple pain, and breast engorgement and infection. Inadequate feeding can be due to reduced milk production or the baby may not be extracting enough milk from your breast. So the most important point in breastfeeding is the proper latching and positioning of the baby. How to prepare for breastfeeding? During your antenatal period, you should attend our antenatal classes, or there are enough number of videos available which demonstrate the proper technique of breastfeeding. So that is very important, the way you position yourself and hold the baby and you latch the baby. And there is nothing to worry about that. It takes time for you and the baby to know each other. So it takes almost a week. And regarding breastfeeding, it's very important that you get to feed the baby within the first hour of birth. And colostrum is an important source of nutrition for the baby. It gives enough and more immunity for the baby, as well as it prepares the gut also. Immediately after birth, that is within first hour of birth, it is important to feed your baby because colostrum contains almost all the nutrient the baby needs in the first 3 days of its life. Colostrum, even 1 teaspoon of colostrum per day is enough for the baby. But you should put the baby to breast at least 8 to 12 times in a day, in 24 hours. And by the time you reach 4th, 5th day, you will be ready to feed the baby and the milk letting also happen. So by then, how do you find out whether your baby is feeding enough or not? The baby will be calm after you put the baby to breast, and also you can watch the baby's sucking movements, and initially it will be quick and after that baby will be swallowing smoothly and baby will leave your breast when the baby is satisfied. And also you can watch at the number of times the baby pees, 7 to 8 times in a day, and also 2 to 3 times of passing stools in a day. And also another way of measuring baby's feeding is by checking the weight gain. Initially in the first week, baby might lose a little bit of weight, 7 to 10%, but after that a well-fed baby will definitely increase the weight. The second cause for inadequate feeding can be inadequate production of milk. How does this happen? If you do not put the baby to breast more frequently, the production of milk will be insufficient. The baby needs to suck on the breast to stimulate the nerves to produce more milk. So it is very important that you feed the baby more often. You do not need to keep the baby to the one breast for a long time. Maybe you can switch breasts. That promotes more production of breast milk. And another thing is pumping the milk using an electric pump will help you to produce more milk. Maybe you can pump your breast maybe for 1 or 2 minutes before you feed the baby. After feeding the baby also, pumping the breast for a few minutes promotes the breast milk production for the next feed. And during night, if you could feed the baby, that also promotes the breast milk production, because prolactin is more, the hormone which causes milk production is more during night time. And when, let's see, come to the second problem, which almost all mothers complain: nipple pain. First reason for nipple pain is nipples can be very sensitive during breastfeeding. So this usually passes off within a week. The second problem is cracked nipple or sore nipple. This again happens because of inadequate latching of the baby. The baby may chew on your nipple and cause cracks and soreness on the nipple. So that is why the latching and the positioning is very important in breastfeeding. If you get sore nipple or cracks on the breast, the first thing you can do is, after breastfeeding, dab a few drops of breast milk onto your nipple and let it air dry. You can also use paraffin or lanolin on the breast, close to the areola and the nipple. And if there is infection or cuts, you can use some antibiotic prescribed by your doctor to prevent infection. Applying too much moisturization and washing it with soap and water also is not advisable. The third cause of nipple pain can be a blocked duct or a blocked pore on the nipple. The blocked duct can be felt as a lump which is long and radiating from the nipple, and the treatment for this is massaging the breast and making the baby suck your breast effectively. The blocked pore can be fixed by scraping with your clean fingernail, or using a flannel or a small needle to chip off that. And the fourth problem of nipple pain could be a fungal infection. Babies who have thrush can cause infection of the breast also. That can be severely painful for the mother. So you might need to put antifungals or take the treatment from your obstetrician. The next problem we have been talking about is related to breast engorgement and infection of the breast. Breast engorgement happens quite often when the baby is not feeding well. So what should you do when you get this painful breast? First of all, you have to see if there is any redness and swelling which indicates infection. If there is no sign of infection, what you have to do is you need to express the milk. You can make the baby suck your breast again, and you can also manually or electrically express the breast milk. And if that also is not working, you can use cold green cabbage leaves. And if there is signs of infection, you definitely need to meet your obstetrician, because we don't want to reach the state of breast abscess, which is a little difficult situation. I hope this video has given you enough information to a happy breastfeeding time with your precious one.